Good morning, this is Dr. McDaniel at GYN Corner. I'm coming from New Jersey Transit this morning. I decided to do a quick presentation on the train because this morning's really busy. I have a lot to prepare for. I'm doing some video sessions for product, and we have short hours today, so I have a lot of things to get prepared for, and when I get to the office it'll be difficult to do presentation, to squeeze it in, and it's not going to be a long presentation. I had this tooth extracted. It's still swollen, still painful, still difficult to talk. I feel like I'm talking weird, but I wanted to get this in. I have about 45-minute ride right now. Yesterday I spoke on preterm delivery, and that was because a viewer requested some information on preterm labor, preterm delivery, because her daughter had 3 preterm deliveries and lost all 3 of the pregnancies, unfortunately. So yesterday, if you look at yesterday's presentation, you'll see that I spoke about the risk factors, and in brief, the largest risk factor is not having one. So over 50% of preterm deliveries occur when the woman has absolutely no indication that she might have such a risk. And then the second largest is someone who's had a previous preterm delivery. So having had one puts someone at a high risk for having subsequent, and those subsequent deliveries will usually occur at much earlier gestational ages, unfortunately. After that, it's going to be anomalies or congenital defects or aberrations or irregular abnormal tissue incontinence of the cervix, so cervical incompetence, cervical insufficiency, also anomalies of the uterus, so having an abnormally shaped or abnormally small, or only having a uterus with 1/2, so a lot smaller, or uterus with septum or wall inside that creates a much smaller cavity. Drug use, having an infection, having chronic illness that decreases blood supply, vascular sufficiency, and those are the primary ones: infection, inflammation, congenital defects, prior history, medical conditions, and drugs like cocaine causes uterine contractions. So those are the risk factors. Now, if we feel someone potentially is, and then the nondescript one, of course, is poor nutrition, poor health in general. Smoking and alcohol. Of course, smoking and alcohol are risk factors for probably pretty much every problem. But it's not just a couple of cigarettes or a couple of drinks right at the beginning of the pregnancy, or a couple of cigarettes, a couple of drinks scattered a handful of times throughout the pregnancy. It's chronic, long-term. Chronic, long-term use. One moment. Give me 2 seconds. It's horrible. Not be doing this train talk anymore. Had my purse, it fell on the floor. Everything fell out of my purse. But for alcohol, it's chronic, long-term use of alcohol and cigarettes, because they will often cause either poor nutrition and or poor blood supply, cardiovascular disease. Now, I will mention some of the screening methods and the monitoring that we do for women who we think are, or we know are at a potential risk of preterm delivery. The main one is an ultrasound or a sonogram, We do that early in the pregnancy to confirm that everything is normal. We do it again in the early mid-pregnancy or second trimester to confirm that there aren't any fetal anomalies or problems. But we can also do a sonogram after 14 weeks, a transvaginal sonogram where a probe is placed in the vagina to look at the cervix and to confirm if the cervix looks normal length and if it looks like it's tightly closed. If it's not tightly closed, we call that funneling, because instead of looking like this, it starts to spread open from the top down. And that funneling is indicative of weakening or insufficiency, incompetence of the cervix. Now, when that ultrasound is done at greater than 14 weeks, we're looking for cervical opening, dilatation, insufficiency, and for the cervical length. Traditionally, we'll do one at 14 weeks to see if there's an early problem, and then once between 18 and 22 weeks to see if there are developing problems. The cervical length should be longer than 25 millimeters or 2.5 centimeters, so it should be longer than an inch. If the cervix is shorter than an inch, less than 25 millimeters, then that's called a shortened cervix. If there isn't any dilatation of the cervix, then we continue to monitor her for continued shortening and or for funneling of the cervix. Studies have confirmed that women whose cervices are less than 25 millimeters and specifically less than 18 millimeters are at a very high risk, 75% or so increased risk of preterm labor, preterm delivery. Now, if there's funneling involved, that increases it twofold. So the first screening method that's done is an ultrasound at 14 weeks and then again between 18 and 22 weeks. The length of the cervix is measured for cervical shortening and then monitoring for funneling. If that lady has a shortened cervix, so it's less than 18 millimeters or less than an inch, then she is at a high risk for preterm labor and preterm delivery. Tomorrow I will discuss the second monitoring or screening method that we can do that's an adjunct or actually is probably, depending on the circumstances, a go-to, a first evaluation. So I'm going to go, the train's starting to get crowded. This is Dr. McDaniel at GYN Corner. Please check out the YouTube channel. That's also called GYN Corner. And as I say, what is it? Like, subscribe, and comment. If you have any questions, please post questions or any topics that you'd like for me to discuss. I can discuss those topics. And tomorrow's Saturday. I'll be coming from the horse farm tomorrow. Sunday and Monday, of course, we're off for Labor Day, so I'll be coming from home most likely, and then I'll be back at the office on Tuesday. I'll continue this presentation on preterm delivery tomorrow. Thank you for watching. Everyone have a great rest of the Friday. Bye.